Welcome back to CRC study session. This is 4. We're going to be discussing in these sessions some counseling theories and other types of related theories. So I know you are excited. I will remind you with the counseling theories, again, I'm just touching on a few high points from each one. So they can go in depth on the exam, and with the scenarios, they are expecting when in those scenarios that you know and understand various theories. So you again may want to read more in depth through your study material about the different theories. This is usually an area. It's counseling and it's the case management area that I have seen where individuals who have not passed the exam, those were the two top areas where they were missing some points or their weaker areas, because the theories are, some of them are really long and have a lot involved in them, and some of them kind of run together where you could be confusing one theory with another because there's so many, and then a lot of the theories of course build off of one another. So it's very important for you to really read them through thoroughly and understand and can kind of differentiate between each one, because this is a top area of where usually this is why a person has not passed the exam, because they were weaker in the counseling area. So with all that said, let's begin with person-centered therapy. And what I've done here in the PowerPoint on the side is just listed, if there was one, listed the main theorists that is associated with that theory or that approach. So Carl Rogers, as you know, is associated with the person-centered therapy, and some of the main points or things from person-centered therapy, there are 3 critical attitudes or values in person or client-centered. So it may be called person-centered or client-centered therapy. The first one is unconditional positive regard. This means that the counselor values and accepts the clients regardless of the issues that he or she may struggle with. The second attitude or value is empathy. The counselor is truly committed to trying to understand what the client is dealing with in their world. And then, of course, there's genuineness. The person-centered therapy relationships must always be an honest one. I mean, how are you really going to build that true rapport with the client if it's not an honest relationship? Let's see. The counseling method in person-centered therapy or client-centered therapy believes people can review and revise their beliefs or values or their other self-concepts if they are provided a therapeutic environment that is characterized by the 3 conditions we discussed previously. So it's that unconditional positive regard, it's the genuineness, and the empathy. Okay. The next approach is the rational emotive behavior therapy, and the main theorist associated with that is Alfred Adler. Now the ABC model of REBT, as you may see it broken down to, which stands again for Rational Emotive Behavior Therapy, holds that clients mistake the event called A for their source of the emotional and behavior consequence, which is C. Between the event and their emotional and behavior consequences is their belief system. So again, it's that the event, which is A, the behavior consequence, which is C, and then their belief system is B. So that's where the ABC model comes from. I've seen a couple of questions that have been related to that, so it would be very good for you to remember and be able to discuss the ABC model. Their belief system, B, is the true cause of their emotional and behavioral consequence. So that's a main point from Rational Emotive Behavior Therapy. Another area for you to read through, and I won't go through all 11 of them, there are 11 irrational beliefs attached to this therapy. And again, let's see, some of them is not, like one is, it is absolutely essential to be loved or approved by every single significant person in one's life. Let's see, number 7 is listed as running away from difficulties and responsibilities is easier than facing them. Remember, these are 11 irrational beliefs. So just kind of go through those and familiarize yourself with that. The third one is cognitive behavioral therapy. There's no single theorist that is associated with this therapy. In your text and in other reading material, you'll find Aaron Beck may be associated with Albert Ellis, even Albert Bandura. So those are some of the major contributors to this therapy. Now, this therapy holds that our thoughts, you can attach cognitive to that, influence our feelings and behaviors, and that the therapy needs to work at correcting those faulty cognitive processes. So it's kind of easy to attach some wording or statements to help you remember and know this therapy, because when you're talking about thoughts, you can think of cognitive, and it's talking about influence on behaviors and feelings, so that cognitive behavior therapy. The emphasis in this therapy is on problem solving and skill development. Let's see, transactional analysis is Eric Berne. It's sometimes called, as some people have said, the poor man psychoanalysis, because of how straightforward it is, and it's a similarity to Freud's superego, ego, and id. It became popular in the late 1960s, teaching many people to better understand themselves in constructs and terminology. It has various levels of analysis: structural analysis, transactional analysis, game analysis, which describes many different games like social roles that people play with one another that lead to bad feelings and emotional pain. And then there's script analysis. But a life script is one of the major acts that a person plays out in life. Very interesting. 4 positions of transactional analysis: I'm okay, you're okay, I'm okay, you're not okay, you're okay, I'm not okay, you're not okay, I'm not okay. In reality therapy, the major theorist associated with this is William Glasser. Reality therapy is very eclectic. It's very versatile, so it's a very different approach. And it's sometimes, because of that, it's kind of difficult to describe. So there's not a whole lot on it, but it's good to become familiar with it. The key concept here is probably knowing that evaluating actions or behaviors from the perspective of responsibility. This is what reality therapy is. Certain actions or inactions have very predictable consequences in different problem situations that you encounter over the course of life. Reality therapy kind of pulls from some other therapies because it emphasizes establishing a relationship with the client. So it's kind of similar to person-centered therapy. It focuses on present problems, though, and behaviors, so it's kind of behavioral. And then it evaluates those problems from the perspective of acting responsibly versus irresponsibly. So it's very cognitive. So again, that's where the eclectic approach comes from. Adlerian therapy is very popular, and of course that is associated with Alfred Adler. Adler, as many know or may know, he was a partner with Sigmund Freud, but he broke from him in about 1911 over Freud's emphasis on the importance of early sexuality in human development. Adler held that social factors such as striving for superiority were far more important. He stated it is natural for the child to feel insecure and inferior and can be a major driving force in personality. He also placed an emphasis on social interests. Freud saw society and the individual at odds with one another. Adler saw society and the individual as mutually supportive. So there's some distinctive things right there that can help you separate Adlerian from Freud or person-centered. Let's see, maybe one more thing on Adlerian. Adlerian psychotherapy seeks to develop people who have high social interests, who are very cooperative. Again, it's about that mutually supportive approach. Okay, let's look at some personality theories. And I have three major ones here. Of course, psychoanalysis with Freud, analytical psychology, Carl Jung, and individual psychology. Let's start with psychoanalysis. This is probably one where most individuals are very familiar with. You learn about Freud usually at a very, very young age in school. Instances where he comes up with his stages of development, where we talk about the oral stage, anal stage, phallic stage, Oedipus or Electra complex. That's very familiar to a lot of individuals. The latency period, and then the genital stage. Very familiar with the defense mechanisms when you're talking about the ego, the id, the superego. So this is one that I don't feel that necessarily we need to go over with, because if you've taken any type of psychology course, you've talked about Freud. So usually this is not one that people are very confused about. Analytical psychology, again with Carl, is that he was also a partner with Freud, but he broke from him as well because of his emphasis on sexuality. The major constructs in analytical psychology are ego, personal unconscious, complexes, collective unconscious, those four functions and attitudes. Those were used to combine and used to develop the assessment model known as the Myers-Briggs. Those functions, thinking, feeling, sensation, intuition, attitudes, which are introversion, extroversion. So you can probably connect the analytical psychology if you think about the Myers-Briggs. That may help you in remembering and connecting that and separating it from other personality theories. Individual psychology, Alfred Adler. Again, we already talked about his split from Freud. The major concepts in this personality theory are lifestyle, striving for perfection, social interest, empathy, inferiority and superiority complexes. Again, even though these two men broke from Freud, you can see that they have taken pieces of his psychoanalysis theory and implemented in their theory. So it's very, very, very apparent in their concepts. One thing that helps me remember individual psychology with Adler is his importance of birth order in personality development, because that's something that very much interests me. So I'm usually able to identify Adler with birth order. That helps me with remembering those theories as well. Okay, moving on to theories of vocational development. Again, there are some other theories that are discussed, or they're discussed more, but these are the major ones that I pulled out. So again, remember to just kind of read through those. This is the area where I talked about in the beginning about testing yourself every few weeks or so. When you're doing the counseling theories, personality theories, and these vocational development theories, this is probably an area where you want to test yourself and see where maybe you may need to focus on one theory over another, because there's so many of them, and again, they kind of begin to run together, especially after studying, for quite some time. So you may just want to take a week or two to study and then test yourself and see where you are in those various areas. First theory of vocational development is trait factor. Now, the trait factor theory goes back as far as the early writings of Frank Parson, and they hold that that individuals need to understand, of course, their abilities, aptitude, vocational interests, skills, those traits, and match these to specific requirements and demands, which are the factors of different occupations. The successful matching of individual traits with job factors is the key to a successful and satisfying vocational choice. Okay, and then the next one that I want to talk about is the psychosocial theory of vocational development. And there are 5 stages. Now, I have seen this, and I have put these into my practice tests as well as part of the CRC exam. So a lot of the reasons for my choices in these study sessions have come from knowing personally and through my counselors what is usually on the test and what I have seen consistently over time on practice tests and things of that nature. So I'm just kind of pulling things out from that knowledge and awareness. But again, make sure you're reading through everything and you're understanding what the theories are discussing and their point of view. That's very important. Now, going back to psychosocial theory of vocational development, there are 5 stages. There's the growth stage, which is birth to 14 years old, Exploration, 15 to 24. This is where an individual begins to develop a sense of occupations, of awareness of occupations. Maybe how to help you remember this in the exploration stage. This is where we talk about transition services with VR. Around the time that they're usually a junior, senior high school, but now with the new acts, the WIOA Act, we're starting earlier, around the age of 14. So that exploration stage is very important to us right now. Establishment stage, that's 25 to 40. This is where an individual is in the actual work situation. You have the maintenance stage, which is middle age to 65. The individual comes in and attempts to improve their situation in their chosen occupation. And then you have the decline stage, which is 65 and over. And this includes the pre-retirement phase, where the individual's attention is on continuing to meet just the minimum requirements of the job rather than on enhancing, their position because they're getting ready to retire. The development theory of career choice is very interesting. And this is Eli Ginsberg. And it postulates that individuals pass through 3 major stages before making their first significant vocational choice. And those 3 stages are fantasy, which is birth to 11. It's where the child thinks of occupations in relation to their fantasies. As a child, what you fantasize about being and becoming. When I grow up stage. Tentative, that's 11 to 17. Here in late childhood and adolescence, the individuals focus largely on themselves. They're just evaluating their interests at this point. And then you have the realistic stage, which is 17 to 18 and up. And this is the focus is on more available careers, what's really out there, the reality, and the evaluation of the demands and the benefits of those careers that are actually out there. And then the last vocational theory that I like to talk about is John Holland's personality type theory. This holds that different personality types are best suited to different careers. And Holland's theory is used a lot in some major assessments like the self-directed search, vocational preference inventory, and the strong interest inventory. He has proposed that 6 basic personality types. He proposed 6 basic personality types and then identified those types based on careers that they were best suited to enter. His model is kind of like a trait factor theory. You remember we were talking about those traits and those job factors. So it's very influential in vocational counseling, and that's how it was able to influence some of the major assessments. that have been developed, like I just discussed, at SDS and the strong interest inventory. Okay, now this is CRC Study Sessions 4. We kind of zoom through those counseling theories, personality theories, and vocational development theories. But again, at least you have some knowledge and awareness of what you need to know, what's out there, and hopefully how to separate those and test yourself on them. I'll see you back here in a few for Session 5.